initially with the drill, just the cuts that I make, because that's tricky. You figured that out.
Yes,
the
unfortunate way.
Yeah, that's a little bit tricky too, and that definitely takes a little bit of time to figure out. What's awesome is we have this acrylic model that we can look at as well. So.
Yeah.
It's okay. I'm just gonna call this. Yeah.
That's a good point.
I'm like, I feel like I'm like,
Yes.
can't touch anything.
Yes.
So I always, whenever I do like a wet lab afterwards, I'm always like, oh, I forgot to say this, or I should have said this, or I could have said this a little bit better. And now like, oh, and it's on video.
Yeah. Yay! Thumbs up.
So one thing one of the dentists told me, which I feel like is really great advice that I try to remember to talk about for every lab, is that there's the green zone, the yellow zone, and the red zone. And when you're doing dentistry and you're in the green zone, like everything is like, you know, teeth are falling out like butter, like everything is going great, you're feeling good, you know what you're doing. And then once you start getting kind of tired, you get into that yellow zone. And like things are still going okay, but you're not quite thinking as straight, you don't feel quite as comfortable, you know, you're struggling a little bit more. And then you hit the red zone, and when you hit the red zone is when you're breaking roots, when you're making mistakes, when you're just not doing the best for that pet. And the key is to know when you're in that yellow zone and approaching the red zone. And it's great when you work in a hospital with other vets, because when you hit the red zone, you're not going to do good dentistry. And it's good if you have that availability to basically get up and walk away and take a break for like 10 minutes. And it's amazing how a 10-minute break can make all the difference in the world. Now, like if you have a dog under anesthesia, that's not ideal. So ideally, if you grab one of the other vets in the practice and say, hey, look, you know, I'm in the red zone, I just need a 10-minute break. And like, even if they're in appointments, like asking if you could grab one of their appointments, which is also not ideal if it's one of their clients and they're like, well, how come we're, let's say, they're in Oregon. But there's some way that you could switch out with another vet for 5 or 10 minutes and just, you know, take a break. I was at the Quendo Center doing training, and the dentist, it was like this second time we were there, they went in and they broke teeth on us and broke roots. Oh. And so like when we got to the pets, it was just a mess. And I was working on one of these cat roots, and I just could not, like, I was like at the point where I was working on it for like an hour and I just couldn't even see it anymore. I wasn't even sure where it was. I was like, you know, I'm just gonna take a break. And I went upstairs and like had a nice tea and a bag of chips for like 10 minutes. Walked back downstairs, sat back down, and looked at the cat. And I'm like, wait a minute, the root's right there. And I had it out in like 5 minutes. And I was partially convinced that someone came and like was working out while I was gone. And I think it's because your brain just totally goes into this place where you can't think straight anymore. Yeah. And sometimes it's nice just to take that break if you can and have someone else jump in. By the way, if you're that person that jumps in and it's like, let's say, you know, Dr. Spencer's working on a mandibular canine, and like all of a sudden you feel it like really loosen up, do not pick it out.
Damn it!
I know.
Like,
I know.
Yeah.
Well, and sometimes
that's even worse when you come back and Corey gets like, oh, it's out, you're all set. like I think you still need that. Like you did 99% of the work, and you need that satisfaction of all that too.
Well, and sometimes what I'll do, like for you guys, or I've done it for the other doctors before, is they say, will you just come in and look at this for me? I'm very tactile, so I have to be able to feel it because my brain can see it better if I can touch it. Yeah. So I might get some instruments in there and just try and feel around a little bit, but then I can give you some pointers as far as what you could do at that point to try and make it easier to get it out. Okay.
Yeah, and that's good too.
Yeah. But I will try and resist the urge. Jolene will hold me back.
So this is my carnasial tooth right here. So this is my distal buccal root right here, and then this is my mesial buccal root right here. And then if you look on the inside, this is the mesial palatal root right here. Mm-hmm. And if you look at these two roots, like it's not like they split right down the middle. And so this root actually kind of comes off the inside. And so when I make my cut, I'll show you. But I actually, on that root, I'll make the cut right across here, basically, on this angle. And if you look on this head, so you can see the same thing, and you see how it actually just kind of like comes off the inside of it. So if you try to cut it down the middle, you'll end up cutting into that root. And so I'll actually come right across here and cut it straight down that way. And these are just great to.
Oh, yeah.
Yeah.
All right, so my base of my flap is always going to be wider no matter where I am. And so I'm going to make one incision here. And for some reason, you'd think that one cut would do it, but you end up needing to make like 5. I'll probably do like 5 of these. And the annoying thing is that once you do the first one, it starts bleeding and then you can't see what you're doing.
Right.
So that's one thing to just keep in mind. And then back here, that's the back edge of the tooth. I'm going to do the same thing. I do it about 5 times. And then I'm going to take my gingival elevator. And what you're supposed to do is you're supposed to have your index fingers up. Never remember what fingers. And have it right here as a guide. So if you slip, you're going to. What I do, and I don't recommend doing, is, and you'll see me do it with elevators as well, is I'll hold it like this, but then I put my thumb right here. So when I slip, I end up jabbing the elevator into my thumb. So it is not uncommon that I'll come out of a dental procedure and take off my glove and have a bloody thumb. And that's a really bad idea.
Yeah.
You know? So, like, you really should try to do it this way. So it's sort of do as I say and not as I do. And whenever you're doing dentistry, you should always be wearing protective glasses. I just got sets of these from Home Depot, and they're like anti-fog. And I think they're like scratch resistant. And they were like $12 each or something like that. And so it's not like they're that expensive, and they're pretty comfortable. And you should always wear glasses when you're doing dentistry. Like if you're the tech doing scaling, cleaning, polishing, you should be wearing glasses. If you're the doc, like you need to protect your eyes, and you should be wearing a cap. I actually brought some gowns with me. They're sort of a hot commodity these days, but I brought 4 gowns with me for you guys. And so you should be wearing, cap, mask, glasses, gown. Most hospitals I go to, like people are not wearing the appropriate PPE. The one thing that everyone wears now that they didn't used to, which is great, are the masks.
Right.
It's funny, I never get to yell at anyone who goes into surgery without a mask. So basically what I'm going to do now is I'm going to start working right here. And when I use this, I tend to do a lot of this rather than that, because I feel like when I do that, that's when I'm more likely to go right through the gingiva. And I might start at one edge or the other edge, or I might start in the middle. Oh, this guy's got a tough. And sometimes the toughest part is just getting in there. And then right on this ridge is pretty much where the tooth ends and the periosteum starts. That's the toughest spot because you bang into it and you actually have to like get up and over it. But when you're trying to get up and over it, that's when you end up jabbing your elevator through. If I do make a hole, I actually made a hole on Thursday. If it's a little tiny hole, I could just put a stitch in it. Or sometimes I'll just cut off that piece right there because you can make a flap big enough that you don't need it. So you see how I'm just kind of twisting? And once you get past that point, then it's so much easier. So once I get to there, now I'm going left and right a little bit. And let's see if I can get the bigger side. And they have, for big dogs, they have bigger periosteal elevators. Some people like the bigger ones. I like the smaller ones. But with the smaller ones, you're just more likely to put a hole through it. kind of just sliding across. And sometimes I like this move too, where you kind of go like that. I'm staying in place where I'm lifting a little bit. You have to be careful with that because you can end up tearing it in a location that you weren't planning. You see how I just slipped there and into my thumb? So I actually ripped it in a slightly different location than what I was looking for, but you know what, that's actually fine. Like that'll be no big deal. So flaps don't always go how I want them to go, but like setting up a good flap before you start, like if you break roots and you didn't make a flap and you don't have good visibility, you're in a lot of trouble. But if you made a good flap to start with, you'll have good visibility to get those roots if you break them. Because I used to be so freaked out about breaking roots, and I mean I still hate it, but at least I know that I can deal with it, and you know, if I have good visibility, it's not that big of a deal. I feel like this edge is gonna rip as well. When it goes around corners, that's where it ends up ripping on you.
Makes sense. In the video that the guy did, he like used his blade around the bottom
Yeah.
edge too.
So-
I hadn't seen that before.
So
Did
that's
you
totally
recommend
cool.
it?
You could do that.
Okay.
I took it right through the ginger on it.
Okay, yeah, it seems scary.
A great place to do that is actually on the inside edge of the mandibular canine,
Yeah,
because
okay.
that actually loosens the periodontal ligament a little bit. But you can totally use the blade to. The other thing I'll do is when I get to here, sometimes I may just grab my scissor and kind of, you know, cheat to assist me. So again, right here, I slightly ripped it in a spot I didn't necessarily want to, but it'll be fine. So what I'm going to do now, actually. I'm pretty much right where I want to be anyway, so.
Jason, do you want additional lighting?
That wasn't working the greatest, but we can try
Okay.
again.
I know it depends on the day.
Yeah.
Is it gonna work for me tomorrow? Maybe. Don't answer that question.
I won't answer that question.
You guys should put in for better lights.
I think it's on the,
It's on the list.
it's on the list. Oh, what
That's
happened to it?
working.
I was gonna say, what's
Turn
the
it down,
turn?
pull it down a little bit. So
Did I turn it off? I don't know.
Chunky the wires on it.
we have the
We
stop.
already
were-
The,
we
the
already did
stop
that
is
once.
in there.
So if you look right now, that's like I'm pretty good, you know, I have pretty good access now. And so any of the tissue that's right here is going to get caught up in your burr. And what happens is it gets caught up in your burr, and all of a sudden your whole
So
flap
weird.
goes into it, and then you
I
just
know.
shredded your flap.
Oh no.
So what you want to do is just push away that tissue.
Pull it back to where you had light, just for grins and giggles. Yeah, it's particular. I guess the touchpad has been fixed as well.
Right. Well, it's not even.
And there's no power on it. There, you have no green lights.
I know. You did.
I know.
Ugh. Right. Oh, sorry.
Yeah.
Oh, no worries.
I'll try again in 5 minutes. We'll see.
Give this some time to think.
Right, yeah.
And so you can see right here, like
Yeah,
this
we
little
should-
flap is, you know, I can suture this, but I can also end up just cutting that little flap off. So now let's say when I want to close this, if you have any tension on your flap, it'll fail. It'll BS. And so I always just use square knots on my simple interrupteds, because if I use a surgeon's knot, I know I can, like, it'll hold with tension, but a square knot won't. And so it's sort of my test to make sure that it's going to stay. So now if I want to, if you look at this flap, if I remove this tooth, look where that is. Like, that's not anywhere. There's no way that's going to come across. So what I do flap, and then I'm gonna try to just go really superficial right here. And this is why it's good to have like nice fine scissors. And I'll feel for the spots that I have the most tension. And obviously you don't want to go through your If I pull it down, I get a little bit more. I could feel that the most of the tension is in the back part here. So this is, I feel like this is the buccinator muscle right there. So all of a sudden, you see how I'm now and the more superficial you are, the better you're going to be, but obviously again, you don't want to go through. And so if I pull this now, see how all of a sudden, see how I have, like now that's almost enough, probably.
Do you always do this step before you don't do your section itself?
I actually
Does it
always do it
matter?
after.
Okay.
Most of the dentists that I saw did it before. Like I felt like they like to set everything up in advance.
Okay.
But I do it after.
Dr. Corrigan also does it after.
Okay.
Because I think I'm just more focused on trying to get that tooth out. You know?
Makes sense.
So now look at where I am. You know, so now I should have plenty of room to close that. And I could cut this off and still get it go up higher, and I can get a ton more. So like I could rep this flap that I have here and actually, you know, create a whole new one and more tissue and bring it down. But you can see like before it was only coming to right here, and now it's there. So the key is just kind of like, you know, undermining superficially and then feeling where the most tension is and releasing that. So let me just show you the cuts real quick, and then I'll have you guys go for it. So I usually will drill over my mesial root and distal root, and then I'll make my cuts. You could make the cuts before. It's up to you. Also, some docs will they'll actually use the gingival elevators to make a little bit of a flap on the medial side, so you have something to dig into. I usually don't. I feel like I have enough room to take bites. But I think that's a cool idea. Some of the dentists do that, is that you can actually make a flap medially. You just want to stay away from midline because there's a huge vessel runs here. But you can also make palatal flaps. So that is something that you can do if you realize you don't have enough room on the lateral side. So let's see.
And then by the phone.
And as far as burrs, I use, to make the cuts, this is a straight burr. So, and they tend to be pretty long. And this is a 701L, but I feel like 700, 701, 701Ls are kind of the typical straight burrs. And this is what you're going to use to split roots. And then I also use, I just call them 2s, 4s, 6s, and 8s. I think it's like actually FG 2, 4, 6, and 8. This is 6. You can see how big that circle, that little ball on the end is. The 2s are tiny. The 8s are huge. I tend to use 6s in big dogs, and I tend to use 4s in, well, I barely use, I think maybe for like a little cat or a little dog I might use a 2, but I tend to use the 4s and 6s probably the most. And the 8s are great, but they end up causing too much damage. You know, like, it just does too much. So this is a 6 for, you know, a relatively big dog. And then I'm going to hold it kind of the same way I hold a pencil. And I pretend that I'm painting, basically, that I'm just brushing, you know, brushing strokes over the top. What you're supposed to do, another thing that you're supposed to do that I don't do, is you're supposed to use your gingival elevator to hold up like this. A lot of times I just take my finger and stick my finger in there to hold it up. The problem is that it's easy to bury your finger. So if I'm doing it this way, so I know my distal root's right here, my mesial root's right here. And so what I'm going to do, I'm basically just moving here.
I know. You should probably move. I'm gonna move over here.
Yeah, I can.
I can see here, so everybody else knows.
Do you see
There,
what I
it's
did right
all
there?
out there because I cleaned it all. Yep.
So that's what you want to avoid, because I just caught like the tip of the edge of some of that tissue, and it didn't really cause any damage, but it pulled my flap right into it.
Yeah.
And if you do that, like, you can make such a beautiful flap, and then you just wreck it in one quick second.
Oh, thank you.
They're
Oh, I have
all
more,
cleaned.
I have more glasses
I'm
on
good.
the
I'm
floor,
behind
too.
the
That's
thing.
me.
I can
Thank you.
take that one. Oh, thanks.
And then I'm going to go for the distal root. All right. So the question is, like, how do you know exactly where the roots are? And I think it's just one of those things where the more you practice, the more you're going to realize where those roots are, and you just start getting used to it, more comfortable with where they are. And you want to leave the middle tissue, like, if you don't need to take it. And so now I have like really pretty good exposure of this mesial root, this distal root. And so I'll take my So now I'm using the 701L. And you could, in a little dog or a cat, you could potentially use a round vertebral teeth. Sometimes, like for the two-rooted teeth, I may use I'm too lazy to like change it. But ideally, you would use this, one of the straight. Well, there's also diamond burrs. Some people use the diamond burrs after you're done to kind of like make sure there's no sharp edges. I would just use my FG6 to clean it up. So I tend to not use diamond burrs much, but a lot of people like the diamond burrs. And just a tip, even though we're not doing this right now, as far as the two-rooted teeth, the way I split them, if I split it right down the middle, when I'm trying to remove one root, the other root's in my way. And so what I would do is, I'll just show you here. So what I would do is I would end up making a cut this way and making this. I'm working on a totally different tooth right now, just so you guys know. So I'd make a cut this way and make a cut this way. So I'm actually removing like a diamond from here. And so now I have one root here and one root here, and they're separate from each other. So now when I'm working on each root, the other one's not getting in my way. Because I find sometimes too, if you're working on one root, you're pushing against the other one, and you can end up breaking the other root that you're not even working on. All right, so going back to this tooth. So where I make my cuts is I want to almost do the same thing where I'm separating these two roots. And so I make this little groove right there. I'll make one cut right here, and then I make another cut that's basically right here. And I'm going to try to do it vertically. Supposedly you're supposed to start from the inside out. I've never fully understood why, because I sometimes start from the outside, and I don't know if you know.
I do both.
Yeah.
It depends. Angle of the dog, size of the tooth, how much exposure I have for you.
And quick tip, so there's other stuff right around the area. Like, make sure you don't put the burr through the endotracheal tube. Make sure you're well aware of where other teeth are, and that you're not going to end up cutting through other teeth. And you see how deep I am in there?
Yeah.
Like this dog, I would not be able. The FG6 is not long enough to get me through. They also make surgical. I think they're called surgical burrs, which are even longer. The surgical burrs are nice. I feel like they're harder to find. Yeah, some all the way through there. You see how I start shallow and I kind of get deeper and deeper. Alright, and then you see how that went flying? Always take it out because, I mean, the chances I think are so low, but like my fear is that as they're waking up and as you're pulling the tube, if that's still in their mouth, they'll end up aspirating it. So now I split these two roots, and you see how far away they are from each other now, so I have plenty of room to work with. If you look, the 09 is so close to the 08 right here. I know some docs that will actually make another cut right here to cut off the back edge of the 08. I'm always afraid to do it because I feel like I'm going to end up getting into the 09. And then what I do, this is the tough part, is now I have this root is all the way over here. I don't know if you guys can see that. So this is that mesial palatal root. And so rather than splitting this right down the middle where I'm going to end up cutting into this root, I'll come from the inside here. There we go. And so you see how medial I am on this when I'm making my cut on this root? And I feel like that's where you had gotten wrong because you were thinking splitting more down the middle. And so now I'm set up that once I get these two roots out, I'll have better access to that sort of cut. Occasionally I don't split it perfectly. I'll be working on this root and I hear a crack and I think I broke it, and it actually just like split the two roots apart. And I also will drill down, once I get this root out, I'll use my round burr to drill down over this root. I find this root the toughest to get out. I always break this root. And so, you know, I'll drill over the top of it to get better exposure. And
Jason, one other thing that I have found helps a lot is because that caudal root is so strong. Before I split the two mesial roots, I will leave them intact and work on the caudal root and then split the two mesial and work those off with each other. So, because then you can use the strength of your two mesial to counteract your caudal, and it just makes it a little easier to get your caudal one out.
That's a good idea. So, but now like you have really nice exposure that you can start working on the tooth. I'm not going to remove it. I'm going to have you guys get going and working on the teeth. And I find sometimes like switching on and off between different elevators, like sometimes if I'm working with the 5 and I just can't get purchase, maybe grabbing the 2 or the 3 and going back and forth helps. But basically I'll usually do this distal root first, and then once I get it out I'll work on the front too. And so I should be able to get pretty good purchase quickly right on the front part, you know, but the back part's tough because you have the 09 right here. So rather than coming in here where you have this tooth blocking you, I usually will start working in right here. And so what I'm trying to do is I'm trying to create purchase right here, a spot for me to grab onto. Some people will do it with the drill. Like I'm just afraid I'm going to end up cutting into the tooth. But I'll start doing this first. And then once I get purchase, once I get in there, you can feel like you put pressure on it. Once you get in there, you kind of twist and hold for 10 seconds. And then you start working over here, and then I'll work on this side. I'll twist and hold for 10 seconds. And then each time you're going back and forth, you're just loosening that ligament a little bit more. And then another cool thing is you take your extractor and grab onto it. Never go that way because you'll break the root, but you push in, and then I'll twist one way and hold for 10 seconds. And then I'll twist the other way and hold for 10 seconds. And then twist the other way And it's possible, like, see how there's a little bit of movement right now?
Mhm.
Like, I mean, the fact that I barely have even done anything and there's a touch of movement, and I find that switching back and forth between this technique and, you know, the elevators is what really gets, and a lot of times this is what ends up getting the tooth out for me, is that twisting motion, because you're really weakening that ligament. This works awesome with the canine teeth. So, and I guess something about the blood, I guess the blood gets in around the ligament and actually makes it easier. And so same thing, I'll push in and give it a twist, hold, and then give it a twist. And so between those techniques is how I usually get the teeth out.
And
So-
to your point about the blood, that's why sometimes I'll split and work on multiple teeth at once. Because then I'll go back and forth from tooth to tooth. I'll create some bleeding in that periodontal space. And then as that blood is working, doing some work for me, I'll move to the tooth next to it maybe, and then go back. So that absolutely does work.
So a really good point is that sometimes I almost get like fatigue of a particular tooth. And so
Yeah.
if I know I'm working on two teeth next to each other, if I'm just getting frustrated with one tooth, I'll just go start working on the other one,
Mhm.
and then come back to the first one, which is, you know, and sometimes just like taking a break from that tooth helps you out. All right, let's go for it. Does anyone have any questions?
You can always ask your tech to help you with counter pressure or putting your angle the way you want it. I can sit and stare at my monitor and hold my hands there. So whatever you need us to do, use our hands.
We use a lot of tongue depressors as well to kind of protect other structures, like if you need to protect the tube when you're drilling, even protect like when you're working on the mandible and that tongue tissue is kind of in the way and you're worried about splitting a tooth, we'll just pop a tongue depressor on the in between the tongue and the tooth. And that way if your drill hits the tongue depressor, it's not going to damage the drill and it's not going to damage the tissue.
And it helps
So-
wick the water out of the mouth and not to the
Yes.
back.
Yeah.
Ooh, I like that part too.
Yeah.
Thank you.
So yeah.